Hello, everybody. Welcome to another Zoom call. I don't know where everybody is located, but we're in the middle of a blizzard. So crazy weather here. At least we're supposed to have blizzard out conditions tomorrow and Friday. So understand if you do place an order for supplements, might not go until Saturday. So, um, all right, just a reminder that casting all our cares upon Him. It's harder to do when we're having struggles and life seems to be turning us upside down, but it's what we need to do in order to stay faithful. Reminder that starting in January, we're going to drop back down to one Zoom call. We're actually not really, because we're going to add a protocol Zoom call. So I have that on the Zoom call page. I should have taken a screenshot of that too. So we're going to add a protocol Zoom call. It's just going to talk about protocols, but it may be on Mondays at noon, but I'm letting you guys kind of decide that. So please send me in the question box on the bottom of the member site when you would like to have a Zoom call. Maybe it's going to be Monday at 7 p.m. Maybe it's going to be, I don't know, whatever works for you guys. And I'll just kind of take a kind of a poll and pick what's going to work best for you. I don't mind doing it in the evening. Um, so give me your ideas about when you'd like to do that. Like everybody's been on the calls to know that the state laws have changed and they're just really buckling down on any kind of practices like mine. They will not allow interstate one-on-one calls. They just don't allow that anymore. It was allowed during COVID and things were really lax about that, but now the powers that be just want to control everything and they're just getting worse. It's getting to be like 1950 AMA, shutting down all the Mexico, shutting down the cancer clinics that weren't doing that were doing anything like nutraceuticals and things. Like they shut down Hoxie and they shut down Rife and they shut down Gerson. That became the Mexico cancer clinics. Well, that's what they're trying to do now. So we're trying to do everything we can just to stay within our guidelines. And I know multiple other practitioners like myself that do very similar things, not cancer, but similar things that try to help people with thyroid issues and things like that. And they are getting the same thing. So they're getting letters from their state boards. And I know a number of you have emailed me saying, hey, I want to fight this. I want to help. This is just so ridiculous. I'm sick of being in this totalitarian government that's, taking over our country. I want to write letters to my senators. I want to call the state boards. Well, I appreciate that. I really, really do. And I think that's how you do get grassroots changes. But please don't use our name. Um, it just will probably cause more fire on our head. Um, and the hard thing is you can't call your boards, but you could talk to senators, you could talk to congressmen, you could talk to your governor. I don't know if it's going to change anything because I hate to be so cynical, but they are literally in they're how they get elected is the nutraceutical or the pharmaceutical companies basically give them money for their election. So it's just the system we live in. We just need to be, I think what this does is it should draw us back to God and to know that, we continue to do what He's calling you, continue to try to fight the good fight. And sometimes fighting the good fight is fighting legal battles against the powers that be. And sometimes fighting the good fight is trusting that God's going to deal with those kind of things. And we need to just kind of keep helping people. That's the approach we've taken through a lot of prayer. We just want to keep helping people. So if I get into a giant legal battle with the state boards, um, I could literally get thrown in jail or something. I don't know. Worst case scenario, I guess I could be fined out of business or something like that. And I just don't feel like that's the direction God's leading me. We're just going to try to abide by their requirements and and I know they're going to get tighter as the years go by, but we're just going to keep doing what we need to do in order to help people. So I can help people, I believe, just as much doing Zoom calls as I can doing one-on-one calls. It's really very, very few people on this that were members, patients of ours that even requested one-on-one calls. some of you that are on this call, but so it's going to affect those few people, but we can still help people just as much on one-on-one calls. Know that we'll be closed the day after Christmas. Therefore, there'll be no Zoom call next Monday. So last Monday, 2 days ago, was the last Monday Zoom call. And then we're going to pick a new day for our protocol Zoom call. So January, we're adding the protocol Zoom call. So give me suggestions on what day and time you prefer for that. So please put it in Central Time. Please understand we're Central Time. Okay, let's get to the questions. This person had hospital treatment recently with blood transfusion and hemoglobin had bounced up with the transfusion, had a CT scan, the tumor had grown and is pressing on the jugular. That's what they were thinking, that it was pressing on the aorta and the jugular. That's why it wasn't operable. And it looks like it's pressing on the jugular, it's blocking that flow on the right side of the neck. They feel as the tumor grows, it will continue to bleed and eventually press too hard on the carotid artery or the jugular, and it could burst. The oncologist says it could be days, weeks, or whatever for this to happen. The patient was putting the knife on his stomach or chest. Can he run on the tumor all night? Yes, you can put it up close to the cancer, as close to the tumor as possible, the better. That's my belief. And he should be running the programs that we made for him. Will this cause die-off to be too fast? No, I don't think so. I don't know. So please keep this person in your prayers. And I just hope that all of you are praying for each other. I think, and you know that I'm praying for you constantly too. There's a clot in his brain. What Rife program should you use for clots? So what Rife programs should you use for clots? There's not specific programs for clots, but there is a circulation stasis program that's 40 minutes. That would be a good program to use. For clots, you want to look at nutrition like Natozyme and Lumbrozyme. Natozyme is nattokinase and Lumbrozyme is lumbrokinase. Those are two enzymes that have been found to help kind of gobble up clots. So that would be good nutrition, the same nutrition that I would recommend if you had clots due to, anything, any reason for having blood clots. I would do Natozyme and Lumbrozyme. And I would be taking, if you know you have a clot, I'd be taking probably 6 a day of each of them. It's an enzyme. You cannot overdose on these enzymes, but they believe the HPV type of cancer responds well to radiation. However, due to the tumor size, now they feel there's nothing to cure him. Radiation chemo may shrink it down, but it's confident it would not get rid of the entire tumor. Yeah, we had discussions about this on one-on-one calls previously. We talked about where the cancer is and how large it is, and you could probably shoot through and not have any damage to other tissue. So I think that would be a good idea. And we talked about that several weeks ago and months ago. Had an annual colonoscopy. The doctor said my rectal tumor has nearly doubled in size. I have been following your protocol to the best of my ability. What else would you recommend? Make sure that you're running the Rife as often as you can, number one. Put the bulb right down between your legs, number two. And then as far as nutritional protocol, consider doubling the black sap bloodroot. Black sap bloodroot can be really effective for colorectal tumors. And then consider adding the Dr. William Kelly's protocol for enzymes, which would be the Digestime Plus enzyme by US Enzyme. Do 15 or 20 caps on awaking and then 15 or 20 caps before bed. I know that's a lot, but if you really follow Dr. William Kelly's protocol with the enzymes that he had available in the 1960s and 70s, you'd be taking 100 capsules in the morning, 100 capsules at night. That's almost undoable. So, but that's really the Dr. Kelly protocol. Now, the enzymes, the digestimes that we have now are a fermented type enzyme, much more powerful than Dr. Kelly's original enzyme protocol. So you could get by with taking less. But you have to keep it about 30 minutes away from food. You want these to get down there and not be absorbed, but to digest that tumor. So that's the whole idea of Dr. Kelly's protocol, is the enzymes are breaking up the tumor. So Dr. Kelly's protocol, I understand, can be beneficial for any cancer, but really for liver, for pancreas, and for, stomach, colorectal, the intestinal type cancers. That's really where it shines. I'm getting the impression that if I want some updated, I think they meant kinesiology testing, I should get up to your clinic for a personal visit as soon as possible before they shut you down completely. Well, I don't have any fear that they're going to shut us down completely. They just don't have the authority to do that. So that's not an issue whatsoever. So you don't have to worry about that. We're going to still be here. It's not even, that doesn't even enter into my mind. So I do think, is that accurate? Overreaction? It's an overreaction. However, we don't do in-office kinesiology visits. So that's not an option for us, but it's not because they're going to shut us down. So we created those protocols. Follow those protocols, use this. So if you want an update to your protocol, like I'm taking this, is there anything else I should add? We're going to have to ask that on a group visit. That's their rule. We have to do things as a group. Here's an example. Okay, not to get too technical into this whole fight with the board and what they're trying to do, is they can't do anything when we teach in a group. When we teach in a group, it falls under free speech education. So there's no way this is ever going to get shut down until we turn into a communist country, which is not looking great, but it's another story. So as long as we stay teaching in a group, I can give very specific instructions on what I would do, because it's an educational format. If I'm doing one-on-one, then I'm practicing medicine, and that's what we can't do. So as long as we do it in a group, you can ask whatever personal question you want. And if you ask it on the member site, of course, nobody knows who asked this question. Matter of fact, I don't even remember who asked this question. So I'm just copying and pasting these questions into this PowerPoint and then going through this. And I don't remember, many times I don't even read the question until we're on this call. So it's very anonymous. So keep asking very personal questions on this site. An update on Anne and AJ. Well, Anne has given me permission to share about AJ. AJ is her 20-now-year-old son, who was diagnosed with acute myeloid leukemia just a couple months ago. And was not doing real well. He went through multiple rounds of chemo, is doing much better, and he's thought to be in a deep remission. However, he is following a protocol from the University of Minnesota that is requiring him to do this very, very heavy chemo 1 week out of the month for 3 months. And he's in the middle, or at the end of his first week, and it's really knocking him for a loop. So please be praying for him too. Thank you. So please be praying for Anne and the family too. When anybody's going through difficult times, it can be just as harder on the family than the person. And we all have to keep that in mind with our conditions, that, maybe we're the ones suffering physically, but it's other people that love us dearly that are suffering emotionally. Just tested positive for COVID. Any suggestions? Yeah, you can run the COVID programs on the Rife. I know this person probably had to get tested because this person had to go in for some type of therapy in the hospital, so they tested it. Certainly, if you had a choice, you're not getting tested for COVID. You understand the test for COVID is completely unreliable to the point of it actually being a joke. So, but if you're forced to get tested for COVID and, then and forced to get treated for it, I mean, that's your choice. Personally, I wouldn't take any, even if I was really sick, I might take ivermectin or hydroxychloroquine. Certainly be taking nutrition, certainly be taking our Clear CV, which is probably just the best collection of was really created for COVID. The Clear CV is the product, but definitely be running the COVID programs on the life. I did a group session and one-on-one with Megan yesterday, and lots of emotional work. Also was on the right for about 3 hours while on the Zoom call with her. I felt good when I woke up this morning, but after my coffee enema, I had lots of cramping and blood in the stool. The blood is mucousy and stringy, if that makes sense. Still having cramping this afternoon. Feels like dry heaves and my stomach or colon. I just finished up my 3rd round of fenbendazole, 4 days on, 3 days off, and ivermectin, 5 days on, 2 days off yesterday. Wonder if this could be an emotional release or a detox reaction. Could. Those are possible for sure. Don't rule out that you might have a little bug or something too. Maybe you got a little flu or something too. So it goes back to, I know when we're not feeling good, we always, equate anything to our disease, but we have to remember that there's, we can have other things going on too. I'd definitely be taking, more immune stimulants or something like that, getting your rest, drinking some tea, just taking it easy, trying to treat it as if you have something that you need to take care of yourself with, obviously. So, but maybe, I don't know, Meg, so this person, one-on-one session with Megan, they're talking about Meg Manzel, who does emotional help with emotional clearing and dealing with deep emotional root causes, who we refer people to. So it certainly could be tied to that too. Is it okay to do coffee enemas while I am taking Ibrance, or should I do them on my 7-day break? I have been doing them 3 days a week. I would say you could continue to do coffee enemas while doing Ibrance. I don't think there's an issue there. Do I have to wait a few days after getting my Zometa and Faslodex before going to the sauna? I don't know. I think you'd be good to wait 24 hours, but I don't think you need to wait, more than that. Can you tell me if berberine would benefit me, and if so, how much? So for those who've listened to me very long, I'm a huge fan of berberine. Berberine has, so many health benefits, even if you don't have, cancer. Berberine is one of the best killers of H. pylori, which has at least a huge comorbidity with anybody with cancer. Anybody with heart disease, you have to kind of expect that you have H. pylori issues. So berberine is a huge killer of H. pylori. Berberine is a great immune stimulator. There's tons of articles on berberine and cancer. There's also tons of information on berberine lowering blood sugar. So berberine can be great to lower blood sugar, which can help cut off the fuel source of a cancer as well. So berberine I'm a huge fan of it. I use the Berber Clear, and the reason why we have the Berber Clear as a private label is it also has alpha-lipoic acid in it, which is such a great antioxidant. So Berber Clear, taking 2 to 3 a day would be appropriate. It's just a great product for so many things. Is there a rife setting for someone who lost their sense of smell from COVID about a year ago? Well, there's a COVID long haul program. I would try that one. The COVID long hauler, I think it's called. That's the one I would use. Don't think you can look up. I don't think there's another program for loss of smell. You'd have to look it up. I don't think there is though. I would do the COVID long haul program. Okay, from the chat. Hi, is 100% pure turpentine for a parasite would help for anal cancer? Well, there is a turpentine protocol for cancer. I know people go, what? Yeah, there is a turpentine protocol for cancer. And turpentine was actually used to treat a lot of diseases back before pharmaceuticals came out. And then it's laughed at, so I don't know what that protocol is. So you'd have to Google that. I don't know what that is, but don't discount some of these kind of old school protocols for different things. A lot of them didn't work and were phooey, but a lot of them did work. So I just talked to somebody on the phone about maybe 2 months ago that was doing the turpentine protocol for cancer, and they had been doing it for a while, and they thought that's what was helping them a lot. So that's the first time I talked to somebody doing that for cancer for a couple of years. Is there something to help bring up white blood cells and red blood cell counts after chemo? Well, your red blood cell counts are beat up after chemo because chemo just kills everything. That's the problem. And really the only thing that's going to really help with that is doing iron and vitamin B12. Your white blood cell counts, bringing up white blood cell is all your immune stimulants. So everything that you're currently taking as an immune stimulant, which is so many things on your protocol, just keep pushing those to build that up. Make sure you're getting rest for sure. That's important to get your white blood cell count up too. That you're not stressing yourself. So think about adaptogens to help with stress after chemo too. And be just running your Rife. There is an immune stimulant program on the Rife that I don't know that I have it in your overnight program, so you can run that. I don't think it's a long program, but look for immune stimulation, I think it's called. Will this recording be available tonight? Yes, I will have it up tonight on the member site. All right, any other questions? Well, then I will say goodbye a little early today, so I can get home before the blizzard hits. Is hemoglobin fine at 9.8? Well, it's still low, but you're not critical or anything like that. So they won't do a transfusion. They won't give you blood until you're at 7.5 or 7.0 at some hospitals. They don't see that as critical until you're down that low. So yeah, 9.8, you might be tired, have some fatigue, but you're not in a critical state by any stretch of the imagination there. All right, please be praying for each other, you guys. And yeah, I won't see you till after Christmas. We celebrated Christmas this last weekend with our family. So yeah, Christmas is Sunday. Have a very Merry Christmas. Keep remembering what Christmas is all about, and keep that in your hearts. Know that I'm praying for you and I love you all. Bye bye now.